Press play.
My name is Melissa Davis, and this is my final assessment. My patient is Michaela Dawes, and before I would enter the room, I would wash my hands and then introduce myself. Hi, Michaela. I'm going to be your nurse today. I'm going to ask you a few questions. Is that okay?
Okay.
So what brings you here today?
Just a general checkup.
So, can you tell me what year you were born and your birthday?
I was born June 25th, 1999.
So that makes you 17, is
Yes.
that correct? How tall are you?
I'm 5'9".
5'9". Make a note of that. 5'9". And let's see. You said you're just here for a general checkup?
Yes.
Any significant past medical history? Do you have any asthma? Allergic to any medications?
Amoxicillin.
Amoxicillin, okay, I see that here. Are your immunizations up to date?
Yes.
Okay. Have you had the flu vaccine?
No.
And do you ever take the flu vaccine recently? No. And you said you had open heart surgery at the age of 2?
Yes.
Can you tell me about that? You know any more?
I had synthetic patches that over holes.
Do you remember any part of that?
No.
Okay. Probably not. You were 2. You said you're allergic to penicillin. Do you take any medications?
No.
Alright. And your social history, what do you do for a living?
I go to school and work at McDonald's.
What do you go to school for?
I go to high school and I go to Votech for culinary arts.
Okay. What's your religion?
I'm Christian.
Okay. In good mental health, no depression, no thoughts of suicide or
No.
anything? Okay, good deal. And how do you eat? Do you eat good?
Yeah.
Eat regular meals?
3 meals a day.
Any energy drinks?
No.
Do you drink plenty of fluids?
Yes.
What do you like to drink?
Tea, water,
Oh,
sometimes
okay.
juice,
Good.
coffee.
How much coffee do you drink a day?
Normally I don't get a lot of coffee a day.
So roughly 1 to 2 times a week or so?
Yeah.
Okay. Have you had any recent travel?
No.
Do you have a good support system?
Yes.
Any sexual history?
No.
Family history. Are your parents living?
Yes.
And how old is your mom?
My mom is 37.
Does she have any significant medical history?
No.
And your dad, is he living?
Yes.
He have any significant medical history?
No.
Your mom's parents, are they alive?
My grandma is.
Okay. And does she have any significant history
Not that I know
that you know of? Okay. And your mom's dad?
He passed away.
Oh, I'm sorry to hear that. And do you know what happened?
He had a stroke.
Okay. And your dad's parents, are they alive?
Yes.
Did your dad's mom have any significant history?
Not that I'm aware of.
Does she have seizures or anything?
Yes.
Seizures? Your dad's dad, is he alive?
Yes.
Does he have any significant history? High blood pressure, surgeries?
He had diabetes and open heart surgery.
Okay. Obesity or anything?
He was obese.
Obese. What about your dad's siblings? Are they living?
Yes.
Does he have any significant history?
Not sure.
So I'll just put unknown. And your mom's brothers or sisters, are they living?
Yes. Her brother is.
And does he have any significant history?
Not that I'm aware of.
What about her sister?
She is dead.
Okay. Do you know how old she was?
No.
Was she young?
Yes.
Okay. And siblings for you. Do you have brothers, sisters?
Yeah.
Okay, so siblings that have either your same dad or your same mom.
I've got 4.
Okay, and how many boys?
3.
Do you know their ages roughly?
One of them is 15, the other is 10, and the other is 12.
Okay, do they have any significant history?
Not that I'm aware of.
And your sister, does she have any significant history?
No.
No. And you don't have any children, do you?
No.
No. Okay. And then when you were born, do you know if you had any difficulties when you were born?
I had holes in my heart when I was born.
Okay. And do you have any significant problems, like any difficulty breathing or
No.
any headaches?
No.
Do you have regular periods?
Yes.
You have a helper, I see.
Yes.
He's kind of annoying sometimes.
A little bit.
Okay, so I'm just going to ask you to stand up so I can just kind of look at you and see if you have any problems. Put your hands to your sides. Good. Good. Let's see. Start with your head, if you don't mind me touching your head. Any difficulty opening and closing your mouth?
Nope.
Do you have any clicks or anything when you, like your jaw pops?
And my jaw pops back here.
So on both sides?
Yes.
Do your jaws hurt when you get up in the mornings?
No.
Okay, so I'm going to check your lymph nodes, your preauricle, your carotid, your tonsils. You still have your tonsils, right?
Yes.
Your postauricle, Mastocyto, can't think of that word. Let's see. Can you hold your phone? Thank you. Sternocleidomastoid. So back here. And then your occipital. And your internal jugular. Do you ever notice you have any lymph nodes swelling? Can you raise your arm up? So your axillary. Thank you. Oh, good. Okay, can you have a seat? Thank you. So your lymph nodes look good. You don't ever notice that your tonsils are swollen or anything at any time?
No.
So I'm going to get your vital signs. Let's see. Have you been running a fever at all?
Nope.
Okay, let me check your oxygen. Check your temperature. .6. Okay, so your oxygen is 98, which is good. And you don't use oxygen, correct?
No.
I'm going to check your blood pressure.
Only to breathe.
Huh?
Only to breathe.
Only to breathe. You got jokes. 22/80, which is good.
No.
Okay, Michaela, so I'm just gonna kind of listen to your lungs and listen to your heart, and then we'll go from there, okay?
All right.
Just take a deep breath and let it out. Take a deep breath. And let it out. Good. Again. Let it out. Lungs sound clear. Let it out. Let it out. And one more. Let it out. Good. I'm going to listen to you in the front. Deep breath. Let it out. Again. Let it out. Let it out. Good. Lungs sound clear. You can breathe normal. Just listening to your heart. I have a little bit of a murmur. Sounds like a grade 3.
I don't know what that is.
They just grade them from 1 to 5, I believe. And it's the, how loud they are.
Is that good, bad? Doesn't matter.
It's okay.
Okay.
Kind of normal since you've had a heart surgery. And we'll listen to both sides of your throat. And then we'll listen to your heart for a minute. So, what's your heart rate at 82? Just checking to make sure you've got a good pulse. And it's regular and it's perfusing like you should. That sounds good. So I'm going to look at your skin and make sure that it looks good, like I don't see any sores, don't see any rashes or anything, and I don't. Looks normal, and that's good. Good skin color, you've got good turgor, So you're hydrated. And I'm going to check your cap refill, and it's less than 3 seconds, so that's good. And check your nails. Let's see, I don't see any ridges or anything in your nails. So they look good. And you're able to move your hands and do your wrists for me. Watch your elbows. Good range of motion. Let me check the other side. I'm going to stick my baby in the TV all the time. So she's got good range of motion. And how about in your neck? You have good range of motion? Down, around. Good. You've got good hygiene. Looks like you have makeup on. Your hair's combed. Let me check your hair for it doesn't feel dry or anything. I don't see any flakes. So that's good. Sorry if you mess your hair. I don't see any warts or anything on your hands. Really down to your lymph nodes. Checked your head. Your scalp is good. I'm going to check your sinuses. For any pain in your sinuses here? Nope. Up here. Good. And there's no inflammation in them, so we're good. I'm going to check your trachea for the midline. That looks good. Can you swallow for me? Do you feel any tugging there?
Nope.
The thyroid feels like it's normal size. For your tonsils, so they're not swollen. Your submandibular. Good. You did range of motion of your neck, and it's good, normal. No stiffness or anything in your neck?
Nope.
Okay, so I'm going to do a vision test to see what your vision is.
Okay.
So I'm going to step back here. And I have the Snellen. Okay, so can I have you cover your left eye and tell me what the smallest line you can read is?
Can you move your pen, please?
Oh, I'm sorry.
ORZSK.
Okay, and can you do the left side?
ORZSK.
Okay, and I'm going to have you read it like you're reading. Can you tell me the smallest line?
ORZSK.
And cover your left eye for me.
ORZSK.
And the right.
ORZSK.
Good. So 20/20 vision on far away and up close. So do 20/20 vision. Okay, so your eyebrows look like they have normal texture. I don't see anything. Let's see. I'm gonna look at what color your eyes are. Green, hazel, kind of hazily looking. I don't see any swelling in your lacrimal glands. They look good. Sorry, pull down your eyelid. Look up. They look pink. Normal. Okay, so I'm gonna get my other two notes. Okay. So I'm gonna do the Rhine-Weber test on you, and basically that just tells you if you can hear with a tuning fork. I don't have a tuning fork, so I'm gonna pretend. I'm going to use a regular fork. So you would hit it on an object, and then you're going to put it above their head. Do you hear it equally?
Yeah.
And then you would put it behind on the mastoid if you're having difficulties on either side, and then as well on the side.
Yeah.
And it sounds good. You don't have any difficulties hearing on either side. Have you ever heard, like, had any ringing in your ears? Or
Occasionally.
And when does that normally happen?
Normally after someone yells really loud, or just being in a concert afterwards.
But like no regular...
No.
No cricket sounds in your ears that you know of? And are you in any extra sports or anything at school?
I am in band.
Oh, you're in band. That's pretty cool. What do you play?
A baritone.
Baritone. So do you have any difficulties hearing when you're like in your marching band? Like too much noise, or you don't have any difficulties? Okay.
Nope.
Looks like you have a helper. What's his name?
His name is Roscoe.
Roscoe, huh?
And he's kind of a turd.
Kind of a turd. Yes, he is kind of a turd. Agreed. Okay, so I didn't see any edema or swelling in below your eyes or in your eyelids. Okay, so I'm gonna get my ophthalmoscope and I'm gonna inspect your eyes. So I need to darken the room. Is that okay?
Yeah.
Excuse me, Roscoe. I think he likes socks. Okay. So this will take just a minute. Put my together here. What did he do?
He just ran into the chair.
Oh, he ran into the chair.
Yes.
Okay, so I'm going to look for the red reflex. Let's see. I'm still not very good at using this, but I'm trying my best. Pupils are equal. Okay, so I'm going to get closer and I'm going to take a look in your eyes. And if you will look past me, I'm going to look in your left eye first. And I don't see that your eye nerves are inflamed or anything. It looks good. Okay, so I'm going to go to your right eye. And I'll look by using my right eye. I don't see any swelling or anything. That's good. Turn this off. There we go. Turn the light off. And the light works. Okay, turn the light back on. Oops, there we go. He said there would be light. Okay, so I'm going to take a look in your ears. And I'm supposed to be able to see your eardrum. There we go. Okay, so I've got the light on. So I'm going to inspect your ears, and there's a clean disposable thing on there. So I pull your ears up. And some earwax. Eardrum, I can't see. So I'm going to go to the other ear. I'm looking at it. Hold your head straight. Thank you. So, oh, I see your eardrum on that side. That's clear. There's got a little bit of earwax. Nothing bad. Okay, so I'm going to switch the little things out. Stop running. Okay. I can stick it in your nose. So I'm going to look in your nose and make sure you don't have any deviated septum or anything. Sorry, major nostril. Your septum looks good. I don't see any bleeding or old blood. And that looks normal. Do you ever have any nosebleeds or anything?
No.
Any runny nose?
Nope.
Sinuses, allergies?
Nope.
Man, you're like the perfect patient. Okay. My crutches. Sorry. Okay, so I'm going to ask you to turn and face me so I can look in your mouth. And I'm going to gag you a little bit, so I'm sorry. Do you have a gag reflex? Okay, there we go. Sorry. Okay, I'm just gonna look at your tonsils. Look normal. I don't see them puffy. I don't see any white patches in the back of your throat. Your mouth looks good. Can you lift your tongue up? Good. And I see you have braces. How long have you had those?
3 years.
3 years?
Uh-huh.
I don't see any sores or anything in your mouth. Sorry to get your gag reflex there. Okay, so I did your ears. Okay, so I'm going to check your hearing through a whispered voice, and I'm going to ask you to repeat the number.
Let's see. Okay. 10.
Good job. Now let me check the other side.
11.
Good. Do you wear earbuds a lot?
Yeah.
Oh my goodness. These kids these days, that's all they wear is earbuds. I actually wear hearing aids myself. Okay, so I looked at your nose and checked. Have you ever had a broken nose at all?
Nope.
No. Your nares look good. Your turbinates look good. No swelling or perforations. Trying to see where I'm at. I'm sorry. Okay, so I listened to your chest and lungs. I'm going to your chest looks good. Equal rise and fall. No abnormalities. Do you need to raise it? Okay, so we're back. and we had to take a little break. So I'm going to do some percussion on your chest, and I'm going to have you lay down.
Okay.
And check your chest first. You want to do the intercostal space. And do the other side. Okay, so I'm going to take a listen to your chest again. Is that okay?
Yep.
Wheezing. Sounds normal. Lungs are clear. So can you put your hands to your side? Thank you. I'm going to listen to your belly. There's some gurgling in there. You ate something?
No.
Maybe you're hungry. A little bit. Okay, so I'm going to palpate your abdomen. I'm going to feel around, make sure I don't feel any masses or anything. Do you have your appendix?
Yes.
Are you ticklish?
A little bit.
A little bit? I'm sorry. Okay, so I'm going to ask you to sit up. And scoot forward just a little bit. Okay, so I'm going to palpate on your back. Check for your kidney. Do you have any pain there?
Nope.
Nope. Okay.